This is the Brown Ultrasound Case of the Month for December by Josh Kane. This is a case of a 61-year-old female who came into the emergency room, history of COPD and pulmonary hypertension, and she came in complaining about shortness of breath and some leg pain. So Josh got his linear probe to interrogate this patient for a DVT. He starts with the linear probe in the transverse plane in the inguinal crease. And what he's looking for is the femoral vein and the saphenous vein and the junction where they meet. You can see here, Josh has compressed above the vein with his linear probe, and the walls of the vein are touching, which says that there's no clot in that location. However, he then moves down the leg distally, continuing to interrogate the vein, and now you can see hyperechoic material within the vein, which represents a clot. Sometimes you're going to see the clot itself. Sometimes you go to compress the vein and the walls of the vein won't touch, which lets you know there's a clot inside. He then moved into the popliteal fossa and he looked to evaluate the popliteal vein, which is above or superficial to the popliteal artery, and found some hyperechoic material in this vein as well. So this is a patient who had a femoral clot and a popliteal clot. So how do you perform a DVT study? You're going to get your linear probe in the inguinal crease, and you're looking for, to start, the common femoral and the saphenofemoral junction. This is what it's going to look like on ultrasound. You've got your femoral vein, your greater saphenous vein, and here's the junction. What I like to do is to compress at, above, and below that junction. I then go about 1 centimeter at a time distally down the leg, compressing as I go, making sure the walls of the vein touch until I get to the split or the bifurcation of the femoral and the deep femoral vein. If you'd like, you can continue compressing along the length of the femoral vein, but you should at least compress until the common femoral bifurcates into the deep and the femoral vein. Next, you want to interrogate the popliteal vein in the knee crease, and you put your probe, linear probe, behind the knee, and you're looking for the popliteal vein, anterior or superficial to the popliteal artery, and you're going to do the same thing. Pressure perpendicular to the skin, evaluating for the walls of the popliteal vein to touch or compress completely to rule out clot. And here you're going to move distally, compressing as you go until the vein splits into the anterior, posterior, and peroneal vein. That's the trifurcation of the popliteal vein, and we want to make sure those veins are compressible as well. What does ACEP say? So ACEP says if you do an ultrasound at the bedside for DVT, you should order a dimer as well. If they're both negative, you've eliminated clot in that patient in the deep veins. If the ultrasound's positive, you'll anticoagulate that patient. However, if the ultrasound is negative and the dimer test is positive, that ultrasound should be repeated in 5 to 7 days. The thought being there could be a superficial clot that propagates into one of the deep vessels.